Hey everybody, Luke Gordon, physical therapist here, and today's question is, if you've had total knee replacement surgery, is it okay to use heat on your knee? And the surface level or the quick answer would usually be where you would jump to would be no, you don't want to use heat on your knee. But I think the real answer, the full answer, is that yes, you can use heat on your knee, but you just want to make sure you use it in the right way. So let me just talk about those 2 points in this video. First of all, why are most people going to tell you no, absolutely don't use heat on your knee after total knee surgery? And then second, if you do want to use heat, how should you use it? When should you use it? How should you apply it so that it actually helps you with your recovery and obviously doesn't inhibit your recovery or slow it down? So again, first things first, typically if you've had total knee surgery, the surgeon, the therapist, the nurses are going to say don't use heat. And the obvious reason to not use heat is because you'd rather use ice because you just had major surgery and things are really inflamed. So, they've made that nice incision. They've really disrupted your quad muscle. There's lots of bleeding. They did cut off the ends of 2 bones. If you didn't already know that, sorry to break it to you. It's a major, major invasive surgery, and that's why there's so much swelling and pain and things like that after surgery. So it makes a lot of sense to do things like ice the knee, elevate it. I've got a whole video on that, on how to reduce swelling after surgery. So there's a lot of good sense around using ice, again, to get the inflammation down. It's an unusual amount of inflammation that you would never hopefully encounter on your own, something that traumatic, So you want to do things to reduce inflammation. So ice makes a ton of sense. And obviously then, why would you want to heat an area that's already so hot? It's so inflamed, it's so swollen, it's angry, things like that. So you would want to heat. It makes a lot of sense. Okay. So, but as it turns out in the clinic, I use heat quite frequently with people who have total knee surgeries. But here's the real catch that I want you to understand is that typically when I'm using heat, it's along the back of the knee or the underside of the knee. Now, if you've had total knee replacement surgery recently, or you've ever had it, you may be familiar with that. A lot of people struggle to get their knee fully straight. Bending is another issue. If you have difficulty getting your knee straight, it can be really, really challenging. And you get a lot of pain on the back side of your knee. Now you look at the back side of your knee and why is it so painful? Why is it so tight back there? Well, there's a couple structures involved. You've got muscles. You've got your hamstrings that cross the back of the knee. And then you've also got your calf muscle. So those can be tight. Those can be painful. The bigger thing back there too, of course, is you have your capsule. The capsule meaning what surrounds the joint and holds the fluid into the joint. Either way, you will have noticed that when you're trying to straighten your knee out, oftentimes it really hurts along the back. And that's where I like to use heat. And the reason I think that you can get away with using heat back there is that because the majority of your inflammation from a total knee is along the front of your knee. So like by your kneecap, by the quads, by your thigh, and that's where you want to ice. The back of your knee, oftentimes to me, isn't really inflamed at all. It wasn't that involved with the surgery. It's just super tight and super painful. So oftentimes what I'll do is I'll have clients, especially if they're struggling to gain full extension or full knee straightening, is that while they're working on straightening their knee, I'll put heat underneath the knee and I'll put ice on top. And that works really well. I'll often do that when their knee is elevated, their leg is elevated, so you're doing multiple things at once. But again, if you're thinking that you might want to use heat to loosen up the knee and to get it going, that can be a really useful tool. There's one other way that I'm going to explain too. Let me just wrap this one up first. So again, along the back of the knee, as long as the back of the knee isn't really inflamed, which usually it isn't, it's just usually really tight and painful when you're trying to fully straighten your knee. Heat can really help with that. So a moist heat pack, rice bag, whatever you've got. So that's the main point. The other point I want to make with heat then is that as you're getting farther and farther out from your surgery date, let's say you're a month out, maybe even 2 months out or farther, if your knee is still really tight and you feel like you've just got to get it warmed up in order to give it a really hard stretch because you're stretching it more aggressively each week, each month because you can tolerate more, heat's a really useful tool then too. So again, you kind of have to balance that. If you're working with a therapist, you can certainly run it by them. At what point are you ready to switch from ice to heat? Or more accurately, at what point can you use heat to warm up everything and then stretch it really hard and then use ice to cool it down? So that's how I approach it. Again, if you're working with a therapist, feel free to ask them what their approach is, what their opinion is, at what point, 4 weeks out, 6 weeks, 8 weeks, whatever, at what point is it now safe for you to use heat on the entire knee, not just the back, to get the thing, loosened up and going. So that's my opinion on heat. For the most part, it can be used successfully with total knees. Again, the surface level, the quick response is always going to be no, just use ice, 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 ice. Some folks even say ice the top and the bottom. I've never been a huge fan of that. I feel like heat on the bottom is more effective. It achieving the range of motion goals. So that's my 2 cents on heat. I hope it helps you with your recovery. I hope things are going well. Please leave me a comment below if you like the video, and I certainly would appreciate a thumbs up and a subscribe before you go. Thanks for watching.